Hey everybody, today I'm going to talk about kinesiology taping for runner's knee. In the clinic, I see runner's knee a lot. Runner's knee is kind of a generalized term or a bucket term for knee pain that you get while you run, normally on the anterior, the front portion of your knee. Often it's indicative of patellofemoral pain syndrome or PFPS, which is kind of another bucket term for discomfort caused by maltracking or abnormalities in your kneecap or your patella. I often also see patellar tendonitis, and people often refer to that as runner's knee too. So there's multiple causes. There's other things that are called runner's knee as well. But I'm going to show you two kinesiology taping techniques that I use in the clinic to help decrease pain in runners who have these conditions. As always, this is an educational video. It's an example of how to tape a knee. I wouldn't want you taping your own knee unless you've seen your physical therapist or your doctor first and they think it's a good idea. With kinesiology taping, you want to be careful because it can decrease pain, but it does not fix the underlying issue that is there. And so you want to be sure that you're addressing the underlying issues as well, which often has to do with strength, mobility. There's many different things that could be going on. So you want to be diagnosed by a skilled clinician first, and you want to have a treatment plan developed. And then this is a way you can help manage the pain, help get back to running quicker, help decrease pain when you're exercising so you can do the exercises you need to do, but it is not a fix for runner's knee or anything like that. In general, KT taping can be good for decreasing pain, which I kind of mentioned already, but it can do this by improving tracking of the patella. It can improve the correct muscle activation. When you tape it certain ways, it can help decrease swelling. There are lots of different ways kinesiology tape can help a runner. The first technique I'm going to show you is a Chopat strap taping technique. It's named after the Chopat strap, which is, you might see there's a strap you can get that will go around your knee and put a little bit of pressure on the patellar tendon, and that can decrease forces through the patellar tendon. This technique could be taped routinely, but you could also use it and see if a Chopat strap of some kind might be beneficial for you to decrease pain or decrease pressure on that patellar tendon. And so generally I would tape someone with that technique and see if it helped. And if it helped, then you could transition to a more permanent patellar tendon brace or Chopat strap while the injury is healing. The second technique I will show you is called a knee hug taping technique. This taping technique is more for patellofemoral pain syndrome. It's good for maltracking of the patella. If the patella, the kneecap, is not moving well in the groove it's supposed to move in, this can help guide it along its way and decrease pain while you're running or performing other exercises. I also have a third taping technique for runner's knee. This one is more specifically for patellofemoral pain syndrome, but I'm gonna hold off on that one today. I'm gonna show you these two simpler ones first, and next time I post, I'll show you the other one. So without further ado, let's look at the Chopat strap taping technique, also called the patellar tendon taping technique. First, you want to make the portion of the tape brace that will apply light pressure to the patellar tendon. The idea behind this portion of the technique is it slightly changes the angle of force on the patellar tendon, which slightly changes the force applied to the tendon when performing a dynamic activity, which decreases the repetitive pressure that has been most likely contributing to the injury in the first place. This piece of the taping brace is made by rolling up a piece of kinesiology tape or pre-wrap and rolling it into a bar, like you just saw in the video. In this case, I used a small piece of kinesiology tape to make the bar. Next, you will need to cut a small piece of kinesiology tape to hold the bar over the patellar tendon. Don't forget to round your edges when you cut this piece of tape. Rounding the edges helps the tape stick better. Tear the backing of the tape like you see me do in the video and remove the backing. Attach the bar to the tape. Find the patella or your kneecap, and then locate the tibial tuberosity. This will be a small to medium-sized bump, 1 to 2 inches below the bottom of the kneecap. Grab the tape with some room left on the edges and give about a 50% stretch to the tape before placing it in between the bottom of the kneecap and the tibial tuberosity. Here is a look at the whole process from a different angle. Notice you are leaving the edges of the tape unstretched. This helps prevent skin irritation and helps the tape to stay longer. push down on the edges of the tape and rub gently to cause it to stick to the skin. Now, let me show you the knee hug taping technique to improve patellar or kneecap tracking. You will cut 2 medium to small strips of tape and round the edges. Find the top and bottom borders of the kneecap. Tear off the backing at the top of one of the strips of tape and place it about 1 inch above the kneecap without any stretch on it. Rub it gently to make sure it sticks to the skin. Apply about a 30 to 40% stretch on the tape as you curve it around the kneecap. Follow the tape with the other hand to ensure it sticks to the skin along this path. Leave about 1 inch of tape at the end unstretched and fasten it to the skin. Here is what the process should look like from a different angle. Notice that the tape crosses just below the kneecap or the patella. Repeat the same procedure on the opposite side of the kneecap. Once again, here is an anterior view of the procedure. And that is how to perform the knee hug taping technique with kinesiology tape to improve patellofemoral tracking. If you have thoughts or questions about any of the techniques seen today, feel free to comment below the video. If you like this content, subscribe to our YouTube channel and like us on Facebook or follow us on Instagram @AthleticKinetics. Thanks for watching. We hope you enjoyed the video.